Good afternoon, everyone. Welcome to another live session with BabyChakra. Hi, welcome. So, hi, everybody. Afternoon. Hi, my name is Deepshika and welcome to BabyChakra's live session. This is the second episode of our In Conversation live series. Really delighted to have all of you on board today because we are discussing a very important topic. And we have a rather very special guest on board as well.
Hi.
Hi, Dr. Lavina Nader. Thank you so much for joining us. Just to welcome everybody once again, thank you so much for joining the second episode of our In Conversation live series. We have a rather special guest with us today, Dr. Lavina Nader, who comes with over 33 years of experience in obstetrics and gynecology. To commemorate PCOS Awareness Month, we are talking to her about all things PCOS. I welcome you once again, Dr. Nader. Am I audible to you, Dr. Nader? Can you hear us? Yes. Can you hear me, Dr. Nader? Okay. Maybe if you want to rejoin the conversation. Thank you so much, everybody, for joining in once again. I welcome all of you to the second episode of our In Conversation live series. We have Dr. Lavina Nader with us, who is joining us very quickly.
Can you hear me?
Dr. Nader, can you see now? Yes, absolutely. I can hear you and can see you.
I can't hear you. Huh? Can you just check the connection?
Just a second. मोबाइल तो दे दो.
Thank you to all those who've joined us this afternoon. Hi, hello. Hello. Thank you for joining us. So we're commemorating PCOS Awareness Month this month.
Can you hear me?
Yes, Dr. Nader, we can hear you. Am I audible now?
Can you check the connection? I can't hear you actually.
How about now? Am I audible to you?
Oh, yeah. Now, yes.
Okay.
Now you're audible. Yes.
Fantastic.
Please go ahead. Sorry, I missed everything. Very sorry.
It's all right. Thank you so much, Dr. Nader, for joining us today. We are about to have a very important conversation all about PCOS because this is PCOS Awareness Month. I'm sure that a lot of people come to you with this question because it is quite a prevalent issue as well. So let's just start from the very basics. What is PCOS and how does it affect a woman's health?
Great. So, it is the most common gynecological disorders seen in women of reproductive age, and it affects about 5 to 10% of women. And if we talk of adolescents or teenagers, I think in India, 5 to 6 out of 10 girls are affected by PCOS. And the most important thing is that it can negatively impact women's hormones, insulin production, circulatory system, and fertility. So that is why it is very, very important to talk about it because it's such a common occurrence.
Right, absolutely. So what are the common causes of PCOS? If somebody has it, how would they know that they do have it?
Okay, so the exact cause is not known, but it has been seen that obesity or, abdominal adiposity, that means fat around the abdomen, and insulin resistance are somehow, they are predisposing factors to developing PCOS. And, a study was conducted by AIMS, and it was seen that in India, about 29% of women are suffering from PCOS, about 40 to 60% had glucose intolerance, about 70% had insulin resistance, about 30% had fatty liver, and 60% were obese. So although obesity is directly linked, but it does not spare anybody. It can affect women of all sizes and shapes, and there are obese PCOS and there are thin PCOS. So, obesity, it leads to increased ovarian hyperandrogenism. Hyperandrogenism means androgen is a male hormone. So there is more production of male hormone in the body and anovulatory fertility. That means ovulation doesn't take place, and that is a common occurrence in 7 to 80% of the cases. So what happens because of excessive androgen or male hormone? The ovaries produce eggs, we all know. So those eggs, remain small in size and they don't grow and rupture, which is the usual process during ovulation. And ovaries are not able to release the eggs. So that is what happens. These are the causes. And there is also a genetic predisposition to diabetes because of insulin resistance. So exact cause is not known, but these are the factors which are generally associated with it.
Is there a particular age where one can already develop PCOS, or it happens later in life, or around when you're 20? Is there a specific age where one can
See,
experience?
yeah, that's a great question. So if there is a genetic predisposition, it may be there. But girls only realize when the symptoms come up during puberty. So most common age is between 20 to 30, but it can, come up anytime. Yeah.
Absolutely. So one must be careful about it. So are there any comorbidities related with PCOS?
Yes, absolutely. So the most common is anovulatory, infertility, means the ovulation is not happening, the eggs are not being released. So it gets difficult to get pregnant. But then, it can lead to type 2 diabetes because of insulin resistance. And if somebody gets pregnant, there can be gestational diabetes. They are more prone to developing high blood pressure during pregnancy. There can be miscarriages. There can be preterm labors. They might have difficulty in sleeping, which is known as sleep apnea. Because of obesity, it has increased body mass index, and that has its own problems. And there is lower health related quality of life. There can be cardiovascular disease. So all metabolic syndrome. So all these are comorbidities which come, along with PCOD because of the factor that, it is insulin resistance is a very common thing.
Right, absolutely. Just going back, I think that's absolutely great information, Dr. Nadir, that you've just shared, and something to keep in mind as well, especially if it's like a genetic condition too. Just going back, I know that a lot of girls, when they do develop PCOS, they have problems of acne, hormonal acne, sometimes even overgrowth of the hair on the body, things like that. I mean, those could also be few symptoms of PCOS. I mean, something to keep in mind.
Yeah, absolutely. Absolutely. So the most common symptoms are infrequent, irregular, or prolonged menstrual cycles. That is the first thing that teenagers or women notice, when their menstrual cycles become irregular, they become prolonged or they become delayed. And then, because of androgenism, there can be body hair, there can be excess facial hair, and we call that hirsutism, and there's a lot of hair fall, and there can be male pattern baldism. So they develop baldness, so they lose hair as if, in the male pattern. So
Yeah.
these are the very common symptoms of PCOS.
Right. So let's say you identify that you have PCOS at a much early age. What are the lifestyle changes you can adapt in order to sort of maybe suppress or reduce the extreme symptoms that it may cause later in life?
So, when we are choosing an effective treatment option, holistic approach is the best. And what we require is a multidisciplinary care, because one thing doesn't matter, because we need to address anovulation. That means we have to address if ovulation is not happening and somebody is trying to conceive, we have to address that. We have to address subfertility. We have to address metabolic conditions like gestational diabetes or even type 2 diabetes. And what happens if PCOS girls become obese? Though there can be body image issues, and sometimes there is body shaming, and so we have to deal with behavioral therapy. So all these things have to go all together. But yes, the most important before we try any medication, as you said, lifestyle modification is the first step, and that includes taking care of weight. So that will happen through diet, through exercise, and see, because if somebody does weight loss, 5 to 10% of weight loss also can lead to restoration of hormonal imbalance. It can improve the ovulatory cycle, and it can improve the chances of pregnancy. So it is very, very important that one should try to get into their ideal weight and lose weight, because weight loss can improve endocrine function. It reduces the testosterone, which increases, and it also improves the lipid profile. And so that everything can be achieved by lifestyle modification like diet and exercise. So what happens is, if our teenagers, these days they're eating out or they're ordering food directly, so they're consuming a lot of processed foods, they're having starchy foods, refined foods, they're having sugary drinks. So what happens? All this leads to insulin resistance. And when insulin resistance happens, it becomes very difficult to lose weight. So we need to understand that insulin receptor mechanism happens in the muscle. So if your muscle is less and fat is more, then insulin resistance is very difficult to treat. So we must focus on having a balanced nutrition. That means having nutrient dense foods which will have adequate protein. Global nutrition philosophy says our diet should have 30% proteins, 30% essential fats like omega-3 fatty acids, because what happens in PCOS is there's inflammation. So we need anti-inflammatory foods. So omega-3 fatty acids are anti-inflammatory. So we need 30% of omega-3 fatty acids and 40% of complex carbohydrates. That means we require raw fruits and vegetables. So, what we require is natural foods which are high in fiber. One can have fatty fish like salmon, tuna, sardines, mackerel, dark green leafy vegetables like kale, spinach, and berries. They're a great source of antioxidants. So I love to have strawberries and raspberries and blueberries, and of course our vegetables like broccoli, cauliflower. So what I mean to say is, there are two foods. One is simple and processed, which is made of refined foods. That is man-made food. We need to cut back on that. And one is unprocessed foods, which is complex, which is God-made. We can pluck from the trees and have it. So what we need to consume more is the God-made foods and not man-made foods. Avoid refined stuff, avoid sugary stuff, avoid foods with empty calories, avoid like fried stuff, avoid junk food. That goes a long way. And sometimes, dairy products that can also cause inflammation or increases insulin levels. So one can avoid, cream and cheese and all that. So diet plays a great role in, normalizing our hormones and managing PCOS. Second lifestyle modification which I want to talk about is exercise. Now, what the second mistake, our teenagers generally make is, they're sleeping late, they're getting up late, so exercise takes a backseat. So exercise really can normalize hormones. It decreases insulin sensitivity. As I said, insulin receptor mechanism is in the muscle. And the only way to build muscle is either to exercise and to take adequate protein. So when we talk of exercise, the modern science recommends 150 minutes of moderate intensity exercise per week. Now one can go for, brisk walk, one can do jogging, one can do swimming. That is moderate intensity. But in case one is too busy, their schedules are like that, then at least 75 minutes of high intensity exercise, including strength training per week, is required to normalize hormones and to build muscle and to decrease the insulin resistance. So that is the second lifestyle modification. The third is, behavioral therapy. As I said, there is, they become very depressed because, it's difficult to lose weight, they lose hope. So, they are depressed and anxious, and so, you require to do a lot of counseling, give them hope, and, do behavioral therapy. And that confidence is very important. And last but not the least is the medical treatment. And the medical treatment would involve, addressing ovulation. So we give ovulation induction drugs like birth control pills. Then we have to treat insulin resistance. So we give insulin sensitizers. And we need to address excess androgen hormone. So we give androgen inhibiting drugs. So all these combined, are the medical treatments available.
Absolutely, absolutely. And Dr. Nader, such important points you've mentioned about nutrition, fitness, as well as just the medical treatment as well. And I'm sure that a lot of people are wondering whether all of this is included as part of the preconception counseling. And would you recommend somebody who has PCOS to go through preconception counseling?
Absolutely. Preconception counseling is very important for every woman, because what we do in preconception counseling is we see whether they are on their ideal weight. That is preferable, because if they start as overweight, then their chances of gestational diabetes or pregnancy induced hypertension is very high. So, preconception counseling is because girls are marrying late. They're having babies late. So, what I want to see is all the girls who have got PCOD. So if you are ready, so please have your pregnancy early. But in case you are not ready and you are around 35, so one option is to freeze your eggs around 35, because it does affect ovarian function. So age is very important. So after 35, the risk of chromosomal abnormalities and high risk pregnancies increases. So in preconception counseling, that's what we see, whether they are borderline diabetes or do they have a family history of diabetes, then their chances of getting gestational diabetes increases. We have to see whether they have any family history of hypertension. Are they overweight? Is there insulin resistance? Is their lipid profile all right? As I said, AIM study showed that they had a fatty liver. So, all these things we can correct. Once you have hormonal imbalance, your thyroid function can, go haywire. So we need to check for your thyroid. So preconception counseling is very important to advise them to correct their hormones, to get them. Vitamin D plays a great role. So that is what we do in preconception counseling. And since there's genetic predisposition, so we work towards that. We look at their blood groups, everything. So it's a very, very important step in managing PCOS.
Those are certainly very important points and something to remember too. If you're going through PCOS, or I guess in general as well, it's best to go for preconception counseling. Now, I wanted to understand, Dr. Nader, can you naturally get pregnant through PCOS, or do you actually need any assistance? As you mentioned, you can also freeze your eggs. That's another option. But is it? Can you naturally get pregnant? And also, is it considered a high-risk pregnancy at the time?
Absolutely. So it is not that people who have got PCOS cannot conceive. they can conceive. See, because cycles are irregular, so one doesn't know when the ovulation may happen. So at times ovulation does occur and people do get pregnant, you know. So one has to use precaution if one doesn't want. It is not that you are in the clear. If you have PCOS, you can't get pregnant. It's not like that. But if you are obese, you have insulin resistance, sometimes because ovulation is not happening, so it becomes difficult to conceive and one might need help. But it is very much possible. See, since there is a genetic predisposition, we cannot cure PCOS, but with a healthy lifestyle modification and medicines, we can keep it under control. And we can also reverse some of the changes that occur through lifestyle modification.
Understood, understood. That's a very important point to remember. Now, when you do get pregnant, is there any special precaution that you must consider for yourself and the safety of your baby?
Absolutely. So the most important is diet. Since, you know, there is PCOS, it must be associated with insulin resistance. So, you know, in India, we say eat for two. So that's not true. Actually, during pregnancy, you only require 300 extra calories. So during PCOS, we must make sure that we are having a nutrient dense diet, you know, we are having balanced nutrition and having low glycemic index foods. That means, you know, whenever we are eating something, so carbohydrate especially, it gets converted into sugar. So your blood glucose levels goes up. So if we are consuming processed foods made of refined foods, starch, it converts to sugar immediately and your blood sugar swings can happen. And you know, one day pancreas says, I cannot produce any more insulin, and that is the time we become diabetic. So during pregnancy, we have to take a low calorie diet with low glycemic index, and it should be nutrient dense. That means there should be adequate protein. It should be rich in fiber, but we should avoid sweets, and we should take care of our weight. We should not increase excess weight because that will predispose us to gestational diabetes. That means pregnancy-induced diabetes or pregnancy-induced hypertension. So one has to be careful. One should have adequate nuts, you know, fruits, dark green leafy vegetables. If one is a non-vegetarian, one must have fish to give you omega-3 fatty acids, walnuts, flax seeds, chia seeds. So these are the good foods to eat during pregnancy, and one must also do adequate exercise during pregnancy so that they don't gain excess weight.
Absolutely, absolutely. Those are critical point, and it seems like everything pretty much boils down to how your lifestyle is essentially. Are you eating the right foods? Are you maintaining your weight properly? And everything sort of falls into place. Dr. Nagar, I'm curious that if you have PCOS and you're pregnant, now you're nearing your labor period, is there any way that PCOS is going to affect your labor, your delivery process, or it has nothing to do with it?
No, basically it's a general preparation, but during the course of pregnancy, during the journey, your doctor will, if required, will give you insulin sensitizers, will take care of your hormonal imbalance. So everything is done from day one. We don't wait till labor, because if you have a healthy pregnancy, the labor is going to be smooth. Okay, but of course we give support, you know, because we give hormonal support because they are more prone to miscarriages. I said there can be preterm labor. So the doctor, you know, your obstetrician will give you adequate support, adequate medication so that, you know, you don't have miscarriage. You know, your pregnancy can continue till term, because in case you develop gestational diabetes, then the child also becomes heavy, you know. So the child becomes overweight, and sometimes we have to deliver early, and it is a high risk pregnancy. If you get gestational diabetes or pregnancy induced hypertension, it becomes a high risk pregnancy. But you know, visit your doctor regularly, your obstetrician, so that they can take care of you. And it's nothing to get scared of. It's very common and it is easily taken care of. But if we take care of our lifestyle, you know, we can work towards it, towards a healthy pregnancy.
Absolutely, it's so important. Like you mentioned earlier, I mean, it all boils down to how you take care of your own body. There's one point, Dr. Nagar, that you also mentioned, behavioral lifestyle changes and how it's important to condition yourself to also, you know, get into the whole zone. So what could be the first few steps of those that you would recommend for somebody to pregnant and has PCOS?
Okay, so besides diet and exercise, that goes without saying. Okay, so one must do some relaxation techniques, some breathing exercises, because stress is very common. As I said, anxiety, depression. So one has to do learn relaxation techniques, do deep breathing exercises, do meditation, listen to positive stories, of patients, of your family members who had PCOD but had a smooth delivery. One must, physically, mentally, spiritually prepare for a natural birth. So you must have listen to positive stories, listen to music, relax yourself, get out, take some fresh air, sunshine, do regular exercises, eat healthy. One must understand pregnancy is not a disease. It's just a physiological phenomena, and for centuries women have been delivering babies, and women's hormones are designed to deliver babies. So one should not be scared. One must address fears. Whatever questions one has, they should talk to their obstetrician. There should be a comfort factor between a doctor and the patient. Doctors are the best people to address your fears, because there are a lot of opinions, lot of myths. If you talk to 100 people during pregnancy, you will get 100 opinions. But I think the best is to note them down when you go for your regular visit to your doctor, discuss everything, and I'm sure they will rest all your fears. But one must form a help group, talk to your friends who have had babies, listen to positive stories, see nice images, and try to be happy and relaxed.
Absolutely, Dr. Nader. That is such a good thing. I feel positive just by listening to all these wonderful things. And certainly, these are changes that one adopts. It really helps them calm down. So, Dr. Nader, there are so many people who are actually asking questions to you directly in the comment section. If you may allow, I'm just going to go and pick up a few questions that we have.
Sure.
Very important question. The one, I believe you answered it previously, but just for her, Poonam Singh asks, how can you get pregnant if you have insulin resistance problems? Is there any treatment, and what can be done?
So you go to your doctor, and doctor will take care, because we can give insulin sensitizers, we can address, your excess androgen. There are certain investigations that we do. So your doctor will take care of that. You just take care of your lifestyle modification. You just try to lead a healthy lifestyle, and that will really take care of a lot of things.
Absolutely, absolutely. And there is another question, Dr. Nader. Source Speaks asks, again, can this happen at age other than puberty?
Yeah, it can happen at any age. I said, it can affect, women of all sizes, shapes at any age. But that is the most common. When you start your puberty, you start getting your periods and they become irregular. That's the first sign. Or they start having hair fall or some facial hair appear. That is when people notice, but it can happen anytime.
Absolutely. Dr. Nader, just going to the last segment, which is really postpartum. I understand that there is not much, except for your lifestyle changes that you can do postpartum when you've had a baby. But are there any specific things when you have a new baby and you're breastfeeding, but you also have PCOS? Any things that you need to bear in mind, especially now that you can't exercise immediately after?
So here also the diet is most important. See what happens in India, we give them all high calorie foods, right? Like we give panjiris and laddus and all that. So it is okay to eat in moderation, but one still needs to take care of the diet in postpartum period. One must have adequate protein, fruits, green leafy vegetables, and breastfeeding is very important. Breastfeeding helps you to get back to your pre-pregnancy weight. It is the best thing for your baby, gives immunity, everything. So you should be, not confined to the bed. You should be up and about, of course, as soon as possible, and take a balanced nutrition diet and cut down on sweets. Because what happens is generally after delivery, our activity gets restricted. So, but it is good to, be up and about and start exercises up within 6 to 8 weeks, and then, of course, take care of the diet. But sometimes there can be postpartum depression. So if there is Don't feel ashamed to tell. Sometimes you just feel like crying, or you're emotionally happy, but you're getting sleepless nights, you're holding the baby like this, it is unaccustomed posture, your back hurts, so many things are coming, you're not getting adequate sleep. Sleep has got a great role to play, because that is what restores your hormones, it repairs your organs, and it is anti-inflammatory. That is one thing which is very important, and the mother is sleep deprived. So, my suggestion is they should try to sleep when the baby sleeps, and, try to get back to work. Work means activity, so that, sedentary life should not continue for very long. That is very important. And in case somebody has postpartum depression, talk to your doctor and we can address that.
Absolutely, absolutely, Dr. Now, there's such important, pertinent points you've just shared with all of us and even answered so many of the questions. Just one last final advice from you for anybody who has PCOS. Is there anything to be worried about for your future, for your pregnancy, for anything in life in general? So if you could share some advice with everybody.
No, fear is false evidence appearing real, right? So fear is where only negatives grow. So there is no need of fear in today's world. There are so many options available, but one should be conscious about it. One should not ignore the symptoms. If you notice something, you must visit your doctor, get yourself investigated, do a lifestyle modification. I mean, it's not difficult. We are just asking to eat healthy and, do some form of exercise. You can dance, you can swim, you can walk, you can run, you can do Zumba. There are so many exercises available. One must do strength training. So whatever one suits according to the time and schedules. So one must just exercise, focus on their diet, stay happy, nothing to be scared of. And these days, if somehow all these drugs are not working, IVF and assisted reproductive techniques are always available. Your doctor will, decide what sort of treatment option you require. So there is nothing to fear or scared of, but one must be conscious about it and must take steps to ensure that you lead an active, healthy lifestyle and improve the health-related quality of life, so that you are not getting any diabetes or cardiovascular health. So all these are important to be healthy, not from fertility point of view, for general health also, because woman is a whole molecule in herself. So woman is responsible for the creation. So from teenagers to reproductive age to perimenopause to menopause, we go through so many transition phases, and so one must, and doing in the midst of taking care of your family and your work, we often neglect our own health. So I urge everybody to spend some time for yourself. Take care of your health. If women are healthy, the whole house is healthy, the whole community is healthy, the country is healthy. So we must be conscious of it and try to lead an active, healthy lifestyle and focus on getting adequate protein, which is 9 out of 10 Indians are lacking protein in their diet. And vegetarian sources of protein are just dairy, pulses, legumes, and some green vegetables. And non-vegetarian sources are eggs, fish, chicken, So one must include protein in your diet, because we are basically carbohydrate eaters. So let's be conscious and make a lifestyle change. That's all, and nothing to be feared.
Absolutely, Dr. Nader, such wonderful words of encouragement, I must say. I'm sure everybody who's joined us, they're all loving your answer right now. Nothing.
Thank you.
Take care of your health and be healthy and mentally, physically, all the way through, and there's nothing to fear for PCOS. Yeah. All right, Dr. Nader.
Absolutely.
Thank you so very much for joining us in today's live. It was really, really informative and absolutely loved having a conversation with you. I'm sure everybody who joined us also really enjoyed this. Extremely informative, very educational. The main motto is really just stay positive and take care of yourself and your mind, body, and soul. So I thank you again, Dr. Nader, for joining us, and to all the people, all the wonderful folks who joined this live, participated, asked us such insightful questions. Thank you so much again for joining. We'll see you again very, very soon next week. So keep your eyes peeled on our live sessions and have a good weekend, everyone. Thank you. Bye.